Hi everyone, and welcome to another episode of Before and Beyond. Today I'll be talking about mouth rehabilitation. And before we actually get to the technicalities of mouth rehabilitation, I just wanted to describe to you when it's actually needed. So what happens is that we do get quite a lot of clients that come in, and actually before they know that there's a problem, usually someone will mention to them that either their teeth look like they're staining quite a bit, or that they're noticing for themselves that their teeth are much shorter than they realized that they had before. And when they come in, we actually see, like this picture that I'm displaying right now, you have a set of teeth where parts of the enamel has actually been very eroded. And the concern is that we see that one of these spots here is that the teeth get really short as well. So let me see whether I can draw that for you. So just around the edges here, around the incisal edges of the teeth, we call them, this person has actually worn the tooth down from two means. So you can wear your teeth down by erosion, which is the exposure to acid. You can also wear your teeth down by abrasion. That means you use an instrument, something like a toothbrush, but it could be other things as well. You know, people have habits where they scratch their teeth with a metal instrument, let's say. We've had people that use pins in their mouths, like people who work with threads and needles. And when they bite onto those pins and needles, they will end up getting these little notches on their teeth, and eventually the teeth will start breaking. So over time, this person in her late 30s has already worn her teeth down to quite a severe level. And when we have to start thinking about oral rehabilitation is when it's not just building up one tooth, but how do we then restore the whole mouth? And that's what rehabilitation is. So part of the rehabilitation as well is that we have to consider what has broken down in the first place, and how do we design the mouth to then go back to its original form. So the first thing is that we take pictures like this, and then we will look at things like the upper and lower teeth, and let's see whether I can show them to you. So we take these pictures as well, and I just wanted to show you these pictures and what actually happens with the wear on their teeth. So where you see the little orange spots on this person's teeth is where the breakdown has actually occurred. So I'm just going to circle them to you. And so we would have this discussion on their first visit that, okay, you've got all this breakdown, but it's not decay per se, but all these areas that I'm circling right now, you're seeing erosion to the teeth. So the teeth have actually worn down by a good 1.5 millimeters. So 1.5 millimeters doesn't seem like a lot, but in tooth perspectives, that usually takes a good 100 years to actually wear this tooth down naturally. So this person has had reflux problems where she's had gut issues. So if you have any reflux issues like that, be mindful that you speak to your dentist about this, okay? So in this case, we had to really consider, okay, what do we do with these teeth? And in all those areas where we have to restore, we have to build up the bite again. So what you notice with a lot of people with very worn teeth, and it might be with you as well, and that's why you're watching this video, is that the lips will start to collapse a little if you have worn down quite a bit of your teeth. So if you've actually noticed that, then it's something that you really want to think about in the future. Okay, now, same person, lower teeth. So if we look at all of her lower teeth, there are some teeth that are worse than others, and we're already starting to notice with the back teeth that there are cracks that are starting to happen with the teeth. Okay, so let me just mark those out for you. So this area here, that's actually a crack. There's also a little crack here, and all this area is actually worn down. So how do we think about this in the terms of designing the restoration? So if you look at this person's mouth as well, there are these metal fillings. So we don't want to leave those alone, since we're actually trying to restore the teeth and restoring the height of the teeth. We can't do them one at a time. We actually have to consider doing all these teeth at the same time. So consider having a table, right? And the legs of the table have actually shortened over time, and you want that table to be raised again. You're not going to raise one leg up at a time, because you're going to get a tilt. Same thing with the mouth. You have to think about it as a platform, and that's where the full oral rehabilitation comes in, okay? And the second thing that we really have to talk about as well, not only about restoring the teeth, but how do we change the patterns of wear? So if it's worn down in the past before this badly, how do we ensure that it doesn't wear down the same way again, and that we deal with the same problem again in about 20 years' time? So that's also a very, very big part of what we would talk about if you were our client. But the most important thing to really work out is the origin of the problem, how are we going to fix it, and also the source of the problem. Let's say you are grinding your teeth a lot, versus if you have a lot of erosion. The materials we use to rebuild your teeth have to withstand the acidic forces, or actually the grinding forces of your teeth, that's going to cause this wear down. And then we just want to maintain it. So I just want to show you the next picture, which is that we design the enamel structure. So this is actually a picture of scanning the teeth, and for this particular person, we would do the teeth sometimes in batches. So we can either do the front teeth or the back teeth first. In this case, I'm showing you pictures of the margins of the buildup that I'm going to do on the teeth. Okay, so you see those blue lines there? That's actually the margin. So we want to stick something onto the tooth, and we need it to be at least about 1 millimeter thick. So how we actually design it is that we will look at your face, and if you've had a lot of wear down and we need to rebuild the height of your teeth by, let's say, 3 millimeters, then I will halve that for the top teeth and half that for the bottom teeth, right? So 1.5 millimeters on the top, 1.5 millimeters on the bottom, and you actually get a full set. Okay, now what we see here is actually something that I would like to talk to you about, is how we design teeth when we look at mouth rehabilitation. So one thing is to draw out the structure of the tooth that needs to be stuck on. And then we have to think about the end in mind, which is, what are the teeth going to look like? We can't just make a block of tooth, especially when we're rehabilitating the whole mouth. The advantage there is that if we had to put a front facing of the tooth, then we can change the color very significantly with the tooth as well. So we can just make the teeth very beautiful again, and it's almost in the realms of smile makeover. But we're not just looking at the aesthetics, but the functionality. Okay, so that's very important to note as well. So just to give you an idea with the picture here, is that we look at the front teeth usually, and that would dictate how the back teeth will also look. But we look at the length of the teeth, and as you will notice that the color of the tooth varies from the edge of the tooth all the way down. But let me go back to an original picture. So I want to show you the picture of someone who has worn down their teeth. You will notice that the translucencies actually change in certain areas here, okay? And then you get these wear downs on the sides of the teeth. So that is a major concern to us, okay? So when we're going to rebuild the teeth, we are going to make the structures whole again, in a sense that I'm going to just draw it for you right here. Is we're going to build up the edges of your teeth around here, like that. And sometimes when we're doing rehabilitation, we are opening up the bite, right? So the bottom teeth will not be in this position as well. But nothing goes to guesswork. So we always scan these teeth, and then we will do a mock-up of the teeth as well. So let me show you what happens next. Once we get from this stage, we will move on to this part of designing. And so in this case, we put it on a model. So in this particular person, I was just building up the back portions of the teeth. So going back to this picture over here, so I've drawn out this backs of the teeth where it's very, very worn down. For this particular person, she didn't have a lot of wear on her front parts of the teeth. So I just wanted to show you that we actually just needed to make a piece that will stick onto the back part that will actually allow us to build up the teeth. And then you can sometimes see in this other case is that we'll build up the ceramic. So then we do one step at a time as well. We'll do the top teeth and then potentially the lower teeth and build up slowly. So a couple of legs in the table analogy, and then later on we'll build up the bottom teeth as well. So then we know actually how things are progressing. Because if we build up, let's say 3 millimeters of your height of the teeth, sometimes it's a little bit much to take. But if it's not, then sometimes we'll actually do everything at the same time, okay? Good. So if you look at some of the other pictures as well, we will see this is actually on a model, and we've only done the 4 teeth, and we were trying to establish the bite and see how this person actually takes the oral rehabilitation, and we do it in piecemeal sizes that the patient can actually cope with. So this is just a little short summary of how we would look at oral rehabilitation, and hope you enjoy it. Okay, see you again.